Hey, this is Jen, and the following video is going to take us through a corrective exercise strategy for a lateral ankle sprain on the left side. Note that in these exercises, when shown on this client, they do not focus on that left-hand side, but if we actually had a legitimate client, we would do that. So for the first portion of this corrective exercise strategy program, what we're going to do is we're going to work on inhibiting and lengthening those tight muscles that are actually allowing that client's knees to come in or those feet to avert and have that ankle issue. Here we can see the client demonstrating foam rolling for the hamstrings, or the lateral hamstrings more specifically, as well as the bicep femoris. What we want to do is we want to have that foam roller, we want to find that point of tension and allow that client to hold on that point of tension for about 30 seconds, to which they would then move on. If we're targeting that semitendinosus or that lateral hamstring, we want their feet to twist out just slightly, and that's going to target the outside portion of those legs just a little bit more. Remember to remain neutral and to keep drawn in as we do this. So this next inhibitory technique that we can see the client doing is she's actually foam rolling for the lateral gastrocnemius or the fibularis. So the biggest thing to note about this is that we're actually turning that foot slightly outwards. You can see how I push that just a little bit. You can also make note of the fact that I'm adding a little bit of pressure, and this is going to better her ability to feel that tension and be able to hold on that point. I can vouch for the fact that when I did this, that the client could actually feel it very much, and she had to really breathe through it in order to release that tension. You want to make sure that they have that nice neutral position at the same time, and you're going to look for a point of tension anywhere between that ankle, so the Achilles tendon, and just underneath that kneecap. Here we see the third method, which is really going to be focusing on that TFL, or the tensor fasciae latae. And one thing that I always tell my clients is that you're going to look for that point in where you would normally put your hand in a pocket, and I feel like this is very effective in telling them that exact area. It might take a little bit to find. This one I find a little bit harder for them. Biggest thing is we want to keep that nice neutral body alignment. So you can see how I stacked those feet, and often I was telling her to keep her core tight and to stay in that neutral position so that that spine remains safe. Okay, now we're moving into a point of static stretching. So this is going to lengthen those muscles that we were just inhibiting. So the first one we see here is for the biceps femoris, or the lateral hamstrings again. She's going to bring that leg up right across and bring it up at a slight angle and hold it up with her own hand. The biggest thing here is we want to keep that pelvis neutral, so we don't want her tilting it as she tilts her leg. Okay, so if that happens, we've gone too far. The next portion is again for that lateral gastrocnemius, or that fibularis. This one, she's going to come against the wall, bring up that foot, and actually turn her toes in just slightly. And this is going to lengthen that outer portion where the fibularis is and that lateral gastrocnemius is. So it's actually going to lengthen it more. Okay, this is just another stretch for that lateral gastrocnemius and fibularis. This is like a typical pike stretch. However, this time she's bringing her feet slightly apart. She's actually going to pull her toes inward slightly, and this way she should feel it on the outside portion just a little bit more. You can make note how she actually doesn't have a neutral spine at the beginning, and it's at the very end that I correct her and tell her to push her chest out a little bit to have that neutral spine. So you really want to look for that as a trainer to make sure that they're not compensating when they're doing a movement. So for the last static stretch that we're going to do to lengthen out those muscles, it's going to be again for that TFL. And this stretch that I chose for her, it's kind of dependent on the client whether they're going to feel it or not. She did feel it towards the end, but we had to manipulate her pelvis just a little bit to find that spot where she could actually lengthen that muscle. The biggest thing here is she wants to keep her core tight. She wants to think about squeezing those glutes, keeping the core tight to allow for that neutral spine, but she really wants to push that hip out right where that pocket position would be. So when we've completed inhibiting and lengthening of those tight muscles, the next thing that we're going to move on to is active isolated strengthening, which is going to work on strengthening those muscles that are actually weak in response to those other ones being tight. So the first thing that we're going to do is we're going to strengthen that posterior tibialis, okay? Here you can see me using a resistance band and my hand manually, but ideally you'd love to use some sort of cable or something like that. And what she's going to do is she's going to bring her toe in slightly. So it's going to start where it's kind of relaxed and flopped outward, and she's going to bring it inwards. So the biggest thing that I told her was she's going to bring her big toe, not leading with the toe, but she's going to think about bringing that toe across to the other side of her knee. Okay, and this was actually quite effective in telling her where she needed to go. The second strengthening exercise that we're going to do is for the anterior tibialis, and this one I used my hands for, and we really want to think about that tempo going 4 on the way down, so nice and slow counts. What we're going to do is instead of having her foot at any sort of angle, she's just going to have it nice and straight, and she's going to pull up nice and straight. One thing I had to do with this one especially is she wanted to lead with her toes, and so I had to manually push them down and make sure that she was actually using that anterior tibialis. So the next strengthening exercise we're going to see is for the medial hamstring. Obviously I'm in my basement here and we don't have the best equipment. Normally you'd love to use some sort of cable, but here I have a resistance band that I'm allowing for her. And what she's going to do is she's going to bend that heel slightly inwards so that her toe is slightly outwards. This was difficult for her. My mom has typically tight hamstrings, and so she was actually cramping with this movement, and she was actually sore the next day as well. But the biggest thing that I noticed with her is that her pelvis would want to shoot outward, and so you really want to make sure that as they're doing that hamstring curl, that they're doing it with proper mechanics. Lastly, we see strengthening of the medial gastrocnemius. Okay, we want to have their feet in neutral, starting with the foot slightly internally rotated. Okay, so we want those toes facing inward. She's going to extend up as far as she can. The biggest things as trainers we want to notice is that those feet aren't falling or collapsing as she comes down. So lastly, once we've lengthened those overly strong muscles, those overactive muscles that are causing those movement compensations, and then once we've activated those weak muscles that are allowing for that compensation, the last thing we want to do is some sort of integrated dynamic movement. And this is just going to allow all those things that we've isolated, lengthened, all those things to come together and move with proper mechanics once again. So the exercise that I chose was a step up to a balance for the first one. This one, obviously, the step isn't too high. Normally we'd like to have it a little bit higher, but for this case, you can still get the right idea. She's going to step up through the weighted leg to a tabletop position with the other leg. So she really wants to bring up her knee as if she could eat something off that, so that we have that maximal stabilization. She's going to hold it there, and then she's going to come down for 4 counts, nice, slow, and controlled. The last dynamic movement exercise that we have is a single leg balance reach. This one, you want to keep that knee position on track with the ankle, not allowing any unweighted foot to swing backwards, and you want to keep controlled while reaching for the toe. She had a little bit of trouble reaching completely to the toe, so we went as far as she had proper movement mechanics, and this I think would be effective for any client.